Y'all know me, I'm Dr. B, and this is the buzz on bad breath. Well, the official word for bad breath is halitosis, a noticeably unpleasant odor to the breath. And according to advertising, boy oh boy, bad breath can certainly ruin your life. Didn't you know it ruins romance? Goodbye, Jim. We could have had a wonderful life together. Those ladies actually got off easy as this woman's own kids can't seem to stand her because of her horrible breath. When bad breath occurs in kids, it's usually in school age kids. And the first thing we always think about is maybe it's just something in their mouth, maybe they had something bad to eat. And many times that's all it is. But it can be from the nose or the sinuses or the lungs or from some other serious problems. So let's talk about all the ways that you can get bad breath. There are a lot of reasons for bad breath that come directly from the mouth. Most commonly, poor oral hygiene is the big reason for having bad breath. Dental plaques and dental calculus can build up. Food debris, not brushing often enough, not brushing well enough. The food can get stuck in there, and certainly as it sits there for a while, it starts smelling bad. Periodontal disease or dental disease like cavities can cause bad breath. The typical tongue coating that you see in kids, that's from normal bacterial growth on the tongue and maybe a little of debris, maybe from milk, that sort of thing. That can smell bad if the tongue is not brushed regularly. Or thrush, which is a fungal disease that can show up on the tongue, usually in babies. See episode 41 for a full discussion of that, but that can have its own kind of funky smell. Dry mouth, not drinking enough water, that can cause bacterial overgrowth, which can cause you to have bad breath. Oral infections like strep throat and mono, a lot of people say that they can smell strep, and some infections do have their own odors. And finally, dental appliances that you see in older kids and teens, those can collect debris and bacteria and cause all sorts of off odors. What about causes beyond the mouth? Well, way in the back of the throat, you can have bad breath from tonsillitis, especially chronic tonsillitis, inflammation of the tonsils. People who get recurrent tonsil infections can get this. Now, if you get recurrent tonsil infections, you're probably going to get these little erosions or holes in the tonsils, these little caverns in the tonsils, like in this photo. And that puts the child at risk of developing tonsillus or tonsil stones. That's collections of debris and bacteria that form these hard little stones that get stuck in the tonsils. These are very common and are commonly a cause of bad breath. Besides the tonsils, there's also the adenoids, which is more lymph tissue found above the palate behind the nose, back behind the nose. And this can get large and sick and also cause strange odors. Post-nasal drip from having a cold and sinus infections going down the back of the throat, and the child maybe sneezes or coughs, you might be able to smell that. And finally, a foreign body in the nose. This is something we always need to think about with the 2 and 3 year olds who like sticking things in their nose for some reason. Usually they're going to be less than 3. After that, we don't usually worry about it, but I have had some kids 4 or 5 years old who might have put something up there on a dare. We did take a bean out of someone's nose, and I think whoever did that knows who they are. We talk about it all the time, but we can't say their name. But usually these kids are a lot younger, and that's one thing we'll be looking for during exams, is seeing if we see any kind of foreign body stuck up the nose. Now, there are some much more rare and very serious causes of bad breath. And if you go online and you Google bad breath, you know what's going to come up, every horrible disease that maybe you've heard of or haven't heard of. But lung infections, pneumonias can cause strange odor when the patient exhales. Reflux disease, gastroesophageal reflux disease, heartburn, burping a lot can cause bad breath. And then there's some very serious problems, some metabolic diseases where you can't digest things properly, or diabetes mellitus. You Google bad breath, it's going to say the patient may have diabetes. But these kids with metabolic diseases and diabetes are usually very sick, so it's certainly not something you need to think about with a well child who just has a little bit off-putting breath. And finally, there are some exogenous factors, some factors outside the body that can cause bad breath. Not drinking enough water, we already mentioned that can cause bacterial overgrowth in the mouth and in the throat. Some foods, garlic and onions, obviously can cause bad breath. Some medications can cause bad breath. And finally, tobacco use. Make sure that if your child has bad breath, maybe they're a teenager, they're not using tobacco or vaping or smoking or using dip. When we start to evaluate this, I always tell my students, age of the patient is everything. So if we break this down by age, we say that if you have an infant who has bad breath, it could be from thrush or from drinking milk and not cleaning out the mouth, or from bottle caries. Toddlers, poor dental care is probably number one. Tonsil issues for recurrent tonsils, and a foreign body in the nose. Again, we always have to think about toddlers sticking things up their nose. School age is the peak age for having breath issues, usually hygiene or ear, nose, and throat issues, tonsillitis. That's a big one at this age. And for adolescent, older kids, using braces or dental appliance, sinus problems, substance use like dip, and anxiety over it. Sometimes the patient thinks they have a problem. They're just really worried that they might have bad breath, but it's just that they're worrying too much about it, and there's not actually a problem. During our evaluation, we're going to be asking all those questions we need to do to find out exactly where the problem is coming from. Because it's usually from the mouth, we're going to focus a lot on questions about dental hygiene, about brushing the teeth, about flossing, about any caries, any dental cavities that they might have had, or any dental disease or gum disease. We're going to look in the throat, we're going to look in the nose, we're going to see if they have any kind of allergies or swelling or sinus infections. And of course, we're going to think about and talk about whether they have any GI problems, reflux, whether they've been snoring, whether they've had a fever and a cough. We're going to try to figure out if it's coming from a system other than in the mouth or in the nose. Now, usually, like I said, this is from an oral problem. So the most important things, make sure that they're brushing their teeth twice a day. Make sure they're getting regular dental care. Make sure they're flossing. Make sure they're drinking plenty of water so that they're flushing out any bacteria that might be collecting on there. Making sure they have a dental appliance, they're getting around that really well and getting any kind of bacteria and buildup off of those. Bad breath may make you break up with Jim, according to Listerine, but otherwise it's not usually a serious problem. If we do see something that's atypical that we're concerned about, we may have the child go see ENT or the lung doctor or the GI doctor if we can figure that it's associated with some other system. Well, that's all from me. Y'all know me, I'm Dr. B. This has been The Buzz on Parenting Pediatrics. We'll see you next time.